Life after breast cancer is often challenging, but Catherine Gross discovered exercise can make a big difference.
I've gone back more to the way that I used to be, to have flexibility, to be free, to express myself, to try to overcome the anxiety and the fear which accompanies one who has experienced breast cancer.
This class in Atlanta is designed especially for breast cancer survivors. Martha Eddy says it's important to cater to special recovery needs of the patients.
There often is an inability to lift the arm if there's been surgery. And so one arm may be able to go high and the other one may only be able to go about this far.
Gentle exercise may also offer a boost for those who have gone through chemotherapy.
I think that patients who exercise probably, get through their chemotherapy perhaps with less fatigue than those that do not exercise.
Daily exercise may also help reduce the risk of breast cancer coming back. With your Health Team 9 Health Watch, I'm Dr. Linda McClintock, Bay News 9. Remember playing with a hula hoop as a kid? Now some grown-ups are picking up the toys again, this time to get in shape.
Harder than it looks, harder to keep it up and keep it going.
Keeping the hoop going is part of the challenge, but with the right equipment, Noelle Powers says that part gets easier.
It is easy with the right size and weight hoop because the heavier and larger the hoop, the slower it revolves around.
The workout goes beyond just exercising the core muscles in the waist.
The beauty of hooping with these kind of hoops is that you can start to take it all the way off your body and start to do a lot of hooping around your arms, which builds your arm muscles, all the way down to your legs.
Participants say it's more aerobic than it looks, and the moves really help them burn calories. With your Health Team 9 Health Watch, I'm Dr. Linda McClintock, Bay News 9. Some of America's favorite foods top the list of some of the worst foods you could eat.
Yes, could I get a 6-piece nugget with barbecue sauce?
The Center for Science and the Public Interest lists the worst diet blunders you can make. The chicken burrito from Chipotle comes in at number 9. Just one has 1,180 calories and 19 grams of saturated fat. That's the same as eating 3 Subway steak and cheese subs.
I think sometimes people don't realize what they're actually consuming.
Eat 1 can of regular soup, and you've had your entire day's worth of sodium.
The places where you're going to find the most sodium will be convenience foods, canned foods, packaged foods, frozen dinners, those type of things, and certainly restaurant food.
Burger King's Quad Melt weighs in at 1,000 calories and 30 grams of fat. This plate of pasta has 2,060 calories and 128 grams of fat, more than most need in one day. Number 5. Starbucks Venti Cafe Mocha with whip. Think of it as a quarter-pounder with cheese and a cup. Also, big diet don'ts: Dove ice cream, Cheesecake Factory's low-carb cheesecake, and McDonald's fried 6-piece chicken strips. The Pepperidge Farm chicken pot pie is number 1 on the list. While you might think the 510 calories are worth it, take a closer look at the box. You'll see that that's just for half of it. Before you think it's okay to cheat on that diet, even just a little, think about this. It only takes 500 extra calories a day to gain 1 pound a week. With your Health Team 9 Health Watch, I'm Dr. Linda McClintock, Bay News 9. Quitting smoking isn't easy, but the American Cancer Society reports smokers who kick the habit won't have long to wait to feel the health benefits.
Within 20 minutes of one's stopping smoking, one's heart rate and blood pressure actually go down. 12 hours after one stops smoking, the carbon monoxide levels in one's blood decrease. About 2 weeks after one stops smoking, one's lung function actually improves, so one is going to be less short of breath and have more exercise tolerance.
A smoker may experience some negative effects of nicotine withdrawal.
You can have shaking, you can have nervousness, even have some depression, increased appetite.
But hang in there, because the benefits of not smoking will continue.
1 to 9 months after one stops smoking, the cough goes away. About a year after one stops smoking, one's risk of heart disease goes down. About 5 years after one stops smoking, one's risk of stroke decreases.
10 years after quitting, The lung cancer death rate is about half that of current smokers. With your Health Team 9 Health Watch, I'm Dr. Linda McClintock, Bay News 9. A mammogram takes about 20 minutes to perform, and while many women dread the brief discomfort, it's a necessary part of the procedure.
The harder they squeeze and squish that breast, the less tissue the x-rays have to go through, the more likely they are to find something.
Following some basic advice can help improve the accuracy of a mammogram and lessen the discomfort.
The best time of your cycle to do the mammogram is going to be when your period's over, probably maybe the week after your period is done, where the breasts are not going to be tender.
Avoid caffeine before a mammogram because it can also make the breast feel tender. Wear a two-piece outfit to make it easier to undress. Don't use deodorant, perfumes, or powders that might leave a residue that can be picked up on x-rays. Make sure to describe any unusual breast symptoms to the technician and let them know if you think you might be pregnant. And going to the same facility year after year will allow doctors to compare the old films to the new films. With your Health Team 9 Health Watch, I'm Dr. Linda McClintock, Bay News 9.
So tell me how your acne is doing.
Acne may be common among teens, but it hit 51-year-old Narva Simmons by surprise.
It was kind of embarrassing when, you're trying to dress very professional, but your face is, just messed up with all these bumps and blisters.
Narva turned to a dermatologist for relief. Adult acne breakouts can be triggered by everything from hormonal changes to sun damage to germs.
Sometimes it can be a bacteria on the skin that has triggered it. And we often test adults with sudden onset acne for bacteria to see if by chance that can be part of the problem.
Adult acne is treated differently than that of teenagers, so the skin doesn't get irritated.
We have to be more sensitive to the fact that these people are not as oily as they were as teenagers.
Some acne will clear up on its own. Lotions and topical creams can help. Narva's case was severe. She used the drug Accutane. With your Health Team 9 Health Watch, I'm Dr. Linda McClintock, Bay News 9. Blow drying is the #1 cause of damage to your hair. Dermatologist Tiffany Hamilton warns patients like Katie Clark to give their locks a break.
If you really want long, beautiful hair, then you're going to have to process much less than you do now as far as coloring, the flat ironing, blow drying.
Katie was forced to cut her long hair after coloring and straightening left it broken and thin.
You will get longer hair eventually if you keep it trimmed regularly, because if you allow the split ends to stay, it's going to keep splitting up the hair shaft and then break off.
Try washing your hair every other day and condition only the ends.
Over-conditioning tends to leave the hair really lifeless, and then that leads to over-styling.
Expensive shampoos and conditioners aren't necessarily better for your hair. Read the label for ingredients like keratin and other proteins that can help repair the hair shaft. With your Health Team 9 Health Report, I'm Dr. Linda McClintock, Bay News 9. If we truly are what we eat, then a new study suggests we might also need to keep tabs on our friends' dinner plates. Researchers now say obesity is socially contagious. Kim and Chris are two ladies who like to lunch.
You'll go meet a friend to kind of unwind, get back into the groove to go back to work.
But researchers say obesity doesn't spread among friends simply because they're eating out together. It's also a matter of sharing ideas about body image. If your friend has gained a lot of weight, then you may feel it's okay if you do too. The study focused on 12,000 participants in a 30-year government health research project. When a person in the study became obese, his spouse's risk of becoming obese jumped by 37%. Same-sex friends had 57% risk of obesity. Best friends ran the highest risk, a 171% chance that they would also become obese.
Before you start dumping your friends because, wow, they're heavy and they eat too much, you have to really read below the headlines.
It's important to remember obesity is part biology and part behavior. There's a common sense approach to gaining control. Lunch out with your friends, split an entree, eliminate dessert, or make an exercise date to catch up.
Too much food makes you fat, not enough exercise makes you fat, And you have to take these into consideration, but do not blame your friends. There is no secondhand fat.
The authors of the study say the flip side is also true. Friends may influence each other to adopt healthier habits too. With today's Health Team 9 Health Watch, I'm Dr. Linda McClintock, Bay News 9.